Two extraordinary revelations today when it comes to the pandemic and what's happening in Victoria. And these are crucial revelations because they help put the threat of the virus into perspective, and they demonstrate that some of the lockdown measures in Victoria, especially the curfew, which has now been extended until late October, it demonstrates how random, overbearing and unnecessary these measures are. And incredibly, the curfew was not something that was imposed on medical advice. First up, some examples of just how bad things are. We know Victorian police are marching into people's homes and arresting them, even handcuffing pregnant women over social media posts about anti-lockdown protests. Now, have a look at these. They're popping up now all around Melbourne. Mobile surveillance units that keep an eye on Victorians to make sure they're not gathering against the rules or getting out and about after curfew.
This unit has been placed here at Victoria Gardens in Paran, one of the popular spots police believe people are more likely to gather in higher numbers or break social distancing rules.
That is Victoria in 2020. Heaven help someone illegally goes to a skate park or walks the dog before dawn. And remember, the Premier, Daniel Andrews, keeps saying he has no alternative. He's only taking the only road that he possibly can, and that he's following all the data and he's following the medical advice. Well, he imposed a curfew on Melbourne. He locked Victorians in their homes every night for 3 months. And this move is not based on medical advice. Have a listen to this amazing exchange today when the Chief Medical Officer, Brett Sutton, spoke on radio 3AW in Melbourne, interviewed by Neil Mitchell.
Has the government ever introduced something without your advice or against your advice?
No, not against my advice. You know, the curfew came in as part of the state of disaster, for example. It wasn't a state of emergency requirement. So, you know, that was something that was introduced, but it wasn't something that I was against from a public health perspective.
But were you consulted on it or not?
Yeah, I was consulted on it, but it was a separate decision-making pathway.
Would you have introduced it?
In public health directions? I'm not sure. I haven't reflected on it. I think it has been useful. You know, if I put my mind to it, probably.
Extraordinary. From a public health perspective, a curfew never occurred to the Chief Medical Officer. He doesn't know if it would be something worthwhile, but having seen it in action, he says he probably thinks it's been useful. Probably. It's only the freedom of people to leave their own homes. It's only an extraordinary peacetime curfew banning people from leaving home, and it's done on the grounds of public health, but the Chief Health Officer did not recommend it, and he's ambivalent about whether it was necessary or useful. And later, the Premier admitted it's not really about public health at all. It's about keeping control over what has become something resembling a police state.
Well, the curfew is about the enforcement of these rules. It's not about crafting the rules. It's not about crafting public health measures. I'm not quite sure what the point here is. There are only certain reasons to leave your home. If you don't have a valid reason to leave your home, then you can't leave your home. And the fact there's a curfew in place, that does grow by an hour. It extends out to 9 o'clock quite soon. That just means the job of Victoria Police is much, much easier.
This is just amazing. Anti-democratic, authoritarian, unscientific, unfair and unreasonable. And yet, after all this, lockdowns, curfews, rules and arrests, it's only now is Daniel Andrews boosting his contact tracing, getting help from New South Wales and working out how to keep a lid on infections properly without crushing society. It defies belief. But there was another important medical revelation from Brett Sutton today. He revealed what many of us know, but so many politicians and most of the media ignore, and that is that apart from being elderly, virtually everyone who dies from coronavirus has a comorbidity, another serious health issue. Now, this is not to downplay the deaths, of course, but this is important when it comes to the public risk, the methods used to suppress the disease in the community and the failures to protect vulnerable people, such as those in aged care homes. Here's Sutton again speaking with Neil Mitchell.
How many of the people who have died had no other medical issues?
Almost everyone has other medical issues, but, you know, a significant proportion of the population, something like 40%, have a pre-existing condition. So it's going to be very common. But they are dying of COVID. They would not have died otherwise.
Almost every one of those who die has other medical issues. Now, this is borne out, of course, by the statistics both here and overseas. And it's not something our politicians like to talk about, though. They prefer to create a sense of fear for everyone. It's dishonest and counterproductive because it undermines public faith in the authorities. And, of course, the fact that comorbidities are so prevalent does not diminish the sadness of these deaths or the need to protect people. But it is crucial information when it comes to public awareness and developing the right strategies to combat the pandemic. After all we've heard today, well may all Victorians ask, well may all of us actually ask, what possible justification is there for imposing a curfew on the nation's second largest city? And some evidence is emerging that Victorians might have had enough. I want to show you an online survey. It's run on Twitter, which normally you wouldn't pay any attention to. But this is run by the Age newspaper, and it asks people if they support the Andrews government's roadmap out of lockdown. And almost 84% of people say no, they don't. This is the Age on Twitter. So you'd think it's a sample that's as left-wing as you can get, as supportive of Daniel Andrews as you could possibly imagine. And they are emphatically opposed to the Andrews plan. We will see. But given what's happening on the ground in Victoria now and how people are being spun lines and treated like chumps, it would hardly be surprising.